Hi, I'm Ben Franklin. I'm a second-year pharmacy student and an ambassador here at the ISU College of Pharmacy. Today I wanted to talk a little bit about where pharmacy got its roots and where it is heading. We are the medication experts, and today for Med Expert Monday, I wanted to talk about where that expertise comes from. Pharmacy has a long history, arguably dating to prehistory. As soon as the first humans began to use plants or animal parts for medicinal purposes, pharmacy began. Some plants were safe to use, and others could even kill you. At first, it was everyone's responsibility to understand what plants were safe and which ones were not. As our species evolved, and as civilization began, people started to differentiate themselves by professions. As one person began to study architecture, another learned blacksmithing. Together, they lost the need to know about those plants that used to be so important. Some would hold on to that knowledge and continued forward as healers or medicine men and women. At first, there was little distinction between what we would consider a doctor and a pharmacist. But even in ancient Egypt, those who practiced medicine were divided into different sects. Those who would visit the sick and those who would stay in the temple and prepare remedies for their patients. Europe saw the influence of the Arabian nations in the 8th century when they brought with them separation of the physician and the pharmacist. The first law separating the two professions in Europe was enacted in 1683. In the United States, Benjamin Franklin appointed an apothecary to the Pennsylvania hospital, establishing the pharmacist as an integral part of the hospital ecosystem. From a lecture given in our first year by Dr. Owens, I remember one of the ways that pharmacy is explained by a reference he made to one of the early pharmacy codes of ethics, summarized as pharmacy being a profession which demands knowledge, skill, and integrity on the part of those engaged in duties of preserving the public health and dispensing the useful, though often dangerous, agents adapted to the cure of disease. Pharmacy has come a long way since it began, and now only about 50% of pharmacists are located in traditional community pharmacy settings. The rest are working in clinics or hospitals alongside other healthcare providers, working for managed care organizations, government entities such as active duty military, Veterans Affairs, or Indian Health Services. They are teaching in colleges of pharmacy and across academia. They work in long-term care facilities and even nuclear pharmacies. As the world of the pharmacist grows, it is even more important that pharmacists are trained to handle all that comes their way. ISU College of Pharmacy has been doing just that for over 100 years, and it is poised to keep doing it for the next 100 years. Idaho is at the forefront of pharmacy practice, as it has some of the most progressive pharmacy practice laws in the country. Nearly everyone lives close to a pharmacy, and you do not need an appointment to visit your pharmacist. This makes the pharmacist one of the most accessible healthcare providers and puts them in the perfect position to provide quick and convenient care to patients with certain health conditions. You can walk into any pharmacy in Idaho, and the pharmacist can prescribe medication for things like smoking cessation, the seasonal flu, motion sickness, cold sores, and uncomplicated urinary tract infections. This helps to fulfill a much-needed role for those who may not have adequate medical insurance, and it saves them an expensive trip to the doctor's office for some of the more routine ailments that they may suffer from. Pharmacy has a long history of progression and innovation. I am excited to be part of pharmacy at this time and to see how the profession continues to advance and change. If you'd like to know more about how you can get involved in pharmacy and become a medication expert yourself, then contact us, as we would love to hear from you and answer any questions that you may have. I hope you have a wonderful and safe holiday season.